This is a special live event called the Over-50 Sciatica Solution Book Launch Special. And that's because I'm launching my new book today, the Over-50 Sciatica Solution, Get Relief Naturally Without Pills or Surgery. So in this special, I'm going to tell you a little bit about what it's about, who it's for, what the benefits are of it, and where you can buy it. Spoiler alert, it's on Amazon, and the link is in the description below. If you are in a hurry, you can just click that now. But for people who do stay to the end, I also have some special free bonuses that are for today only. But it's only $1.99 for the Kindle version on Amazon. If you don't know who I am, I'm Dr. Dave Candy. I'm a doctor of physical therapy, and I have been a physical therapist for 17 years. And over that time, I've seen a lot of patients with sciatica, and I've gotten pretty good at treating patients with sciatica, particularly people with chronic back pain and sciatica that hasn't gone away. In fact, my first book was called Chronic Pain. You're not just getting older, you're not crazy, and it's not all in your head. This one actually got to be an Amazon bestseller back at the time it launched, and I'd love to do the same thing for the Over-50 Sciatica Solution. So please grab a copy if you would like to support that. But here's what the book is about. It is a book that's divided up into 3 parts, and chapter number 1, or part number 1 rather, is just about helping you understand sciatica a little bit better. There are a lot of confusions about sciatica. Even just the name or even what it is can be quite confusing. In fact, if you take 5 different people who say they have sciatica, one person might just have localized buttock pain or SI joint area pain. One person might have some radiation to the back of their thigh. One person might have it go all the way down their leg. One person might have it in both legs. Some may have numbness and tingling. Some just have pain. And so there's this umbrella term of sciatica, but just having that label or diagnosis doesn't really lead you towards any treatment. So part 1 helps you to understand sciatica better, particularly in regards as it relates to people over 50, because younger people tend to have one type of sciatica that's typically most common in the 30 to 50 age ranges. And usually that's associated with a bulging disc or a herniated disc pressing on the nerves. As you start getting older, those discs actually start to dry out. And so the odds of herniated discs pressing on nerves and causing sciatica becomes much less common, and things like degenerative disc disease or spinal stenosis also become more common. And the funny thing is that the way that you would treat sciatica in a younger person may not be the same way that you would treat, or probably isn't the same way that you would treat sciatica in an older person. And so it'll either not help or maybe even make the problem worse. So I do describe the different causes of sciatica. Another misnomer is piriformis syndrome. A lot of people who have localized buttock pain and some sciatica or symptoms going down their leg may have heard of the term piriformis syndrome. Stretching the piriformis is a really common treatment, but actually piriformis syndrome is rather rare. It's only maybe 10 to 20% of cases of sciatica at the most. And in my experience in people over 50, it's much less than that. So that's part 1. Part 1 just gives you a better understanding of sciatica, the causes, and the particularities about people over 50. Additionally, some of the things that happen as you age, for example, hormonal changes and things like that, they can also affect the way that you recover from sciatica, the way you experience sciatica. And so I go over that in part 1 as well. Part 2, I think, is really my favorite part of the book. It was my favorite part to write. Just a little bit of background. I have a clinic in St. Louis, Missouri, and I realized that no matter how busy I filled my schedule, I could only help a certain number of people per day. And even if I scaled the clinic locally, it's still kind of capped out by staff members and number of hours per day, which is kind of what started me down the YouTube path and the writing path of being able to help more people and being able to scale my impact. So that's kind of what this book is about. And part 2 is really the process that I use in the clinic when evaluating a patient with sciatica, but sort of in a do-it-yourself at-home version. And so it walks you through some of the different subjective questions or history questions that I would ask a patient. It also walks you through a self-exam that you can do at home to get a better understanding of the causes and triggers of your sciatica. Now, I should note this doesn't serve as a substitute for seeing a healthcare professional. You should actually get it checked out by a doctor or a physical therapist or someone who actually went to school and got trained on the problem, but it does give you a lot of good insights. It'll also help you to better communicate to your healthcare providers to help them help you better. And then part 3 is probably the part that most people are actually interested in. is the treatments that you can do for sciatica at home. And there are a lot of stretches and exercises in there, but they're not just stretches and exercises. There are different things that you can learn to do to help with functional activities that commonly bother people over 50 with sciatica. Standing and walking are probably one of the most common ones, so I address that. If you get a catch in your back when you get out of a chair, I have tips in there for that. If you feel stiff in bed at night or have trouble rolling over, getting out of bed, I have tips with that, along with tips to help you sleep better overall. If you have trouble riding in a car for long periods of time or sitting for long periods of time, I have tips to help out with that. So a wide variety of different tips to help people with different varieties of problems. And because sciatica is a very heterogeneous, meaning it's not all the same type of problem, there are different treatments that are going to be better for one person with sciatica and another. So it's very likely that you won't need to do all of the treatments that are in part 3, but there's a wide variety to choose from. And the assessment in part 2 will help guide you towards the ones that are maybe more likely to work for you and less likely to work for you. So that is the breakdown of the book. Now, as far as where it's available, it is available, like I mentioned, on Amazon, and it's only $1.99 on the Kindle version today. The regular book is full priced, and that's just printing costs. But to get it out to as many people as possible, I did want to offer it for $1.99 today. That will go up tomorrow. And I mentioned that I also had some special launch bonuses. If there's anyone in the chat, just let me know that you're watching. If you have bought the book as well, also let me know that. I'd love to see how many people have bought the book already. But the launch bonuses. The launch bonuses include the audiobook. And if you look on Amazon, there's not even an Audible version available yet. There may be at some point, but when you buy the Kindle version for just $1.99 today, I'll also include an audiobook version, which I'll send to you directly by email. There will also be a couple of extra bonuses, including the pain-free standing and walking guide. Like I mentioned, walking and standing for long periods of time are often some of the most bothersome activities for people with sciatica. So I did want to make sure to include that in there. And you get that absolutely free with your Amazon purchase today. You just have to go to a form, which I'll put down in the pinned comment after I get done with the live stream here, and fill out that form to claim your bonuses. Additionally, there's a sciatica symptom tracker. This helps you a lot with part 2 to better understand the causes and triggers of your symptoms, and it also guides you to which treatments to use from part 3. Again, don't use it in place of seeing a healthcare provider, but it is something that can be incredibly helpful, and again, give you some good insights to talk to your healthcare provider as well. The third bonus is a morning relief stretch routine. So if you're stiff and sore when you wake up in the morning, then the morning relief stretch routine will help you out. So I will put the link down in the description for the book. It's already there. I'll also put the link for the bonus claim form. But if you go to over50sciaticasolution.com or over50sciaticasolution.com/launch, LAUNCH, you can claim the bonuses after you've bought your Amazon book. You just put in your order number, and within 48 hours or so, I'll get the bonuses out to the people who qualified. Thanks for watching, and I hope you enjoy the book.